Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that's all I do. All I do is perform aesthetic or cosmetic surgery. I'm very excited about the procedure that I've created called a GenXLift, and a lot of people are wondering, they're hearing about it, and they're really wondering, Dr. Shapiro, what is a GenXLift? Well, a GenXLift is a specific facial cosmetic surgery procedure that is really targeted for people that are between the ages of around 33 and 55, which is actually the Gen X population, Generation X. Now, why that's an important population is it consists of people that have some of the signs of aging that tend to progress chronologically and may not be ready for having the full facelift. You know, a lot of people find that the word is intimidating. They feel that they're too young to have a facelift, want to have some variation of less invasive surgical procedures, want to know what kind of combinations are possible these days to obtain a really beautiful result with maybe not having the full facelift, not encountering the longer recovery time, and then again the financial burden of having a full facial rejuvenation. So a GenXLift is a staged procedure. The first stage is in younger patients, and that usually consists of having some of your own fat transferred into your face where you've lost volume. A very normal thing is to lose fat in your face as you age, so that tends to make us look gaunt. The other part of that first stage of GenXLift is also doing some resurfacing of your skin to make the skin texture and color look more youthful. I think there's a whole spectrum of sun damage that we see, especially in Arizona, being exposed to the sun. There are some laser procedures that I can combine together to get some of the color to look more soft and natural, and also to increase the youthfulness of the texture, minimize the fine lines, make the pores smaller, and that's a combination of a couple of laser procedures that we call a 4-day laser peel. That's important because it only takes about 4 days to heal from that. I think those two combined are the best entry point for somebody looking for a GenXLift and that are younger. As people start to get a little bit older, they have those problems. They have the loss of volume of the face, they have the skin texture and color changes, but also start to see manifestation of some of the changes in their neck with some skin laxity. So there are some things that we can do for that in combination with the laser therapy and the fat transfer. Generally, we can do some liposuction in the submental region to help tighten the skin and remove some of the volume that may be there. Also, there are some non-invasive treatments, whether it be radiofrequency or something called ultherapy, which uses ultrasound to tighten the deeper tissues of the skin and neck, including the muscular layer and the subcutaneous tissue and skin. So those combined together is the stage 2 of the GenXLift. The last stage, I think, is really for people that have more advanced signs of aging, with a creation of some jowls in the face, along with some laxity along the jawline. You start to lose the definition there, along with some laxity in the neck. In those people, I like to do the fat transfer along with that laser resurfacing in combination with a short scar facelift. So that is a facelift that has an incision along the sideburn, inside the ear, down to the earlobe, and through that incision, I will tighten the deeper layers of the face that have the muscles and fat, resuspend them to a more youthful position, and then go ahead and remove any extra skin that is created. And no one's the wiser. Those incisions heal beautifully, and no one should know that I've even done that. The recovery is a little bit longer, but really not longer than a week or 10 days. But overall, I think the GenXLift is a very exciting addition to my practice. I think there are many people that can benefit from it, and I think the best way to find out if you're a candidate is come in for a consultation. Thank you.